Hello, everyone. This is me, Dr. Amr Mohammed. I am a pediatric ophthalmologist from Yemen. I'm also assistant professor of ophthalmology in 21st University in Yemen. And I got FRCS Glasgow Part 3 in May 2024. And in this short presentation, I will give you some tips about how to pass FRCS Glasgow Ophthalmology Part 3. So first of all, you need to prepare well. So you need firstly to evaluate your situation because candidates are not the same. Everyone has his own situation and his own circumstances. So some candidates are fresh graduates. Some of them are consultants who already finished board exams years ago, and some are subspecialty consultants who are focused on a specific subspecialty for many years. And I was the third type of candidates because I'm practicing pediatric ophthalmology, strabismus, and neuro-ophthalmology since 2019. And because of that, I was away from other subspecialties and I needed a longer time to prepare for the exam and to remember and memorize the information in all other subspecialties like glaucoma, retina, and cornea. Also, you need to tailor your study plan with time frame. So you need to sit with yourself, evaluate your situation, and gather your study resources and put a time plan. So you need to know which textbook you will study and how much time you need to finish it, 2 times or 3 times at least. So you will memorize the information in this book. Usually, FRCS exam committee will confirm your seat for the exam only 2 to 3 months before the actual date of the exam, and sometimes even shorter notice. So prepare before that. You need to start preparing before getting your seat for the exam. So, for example, if you are planning to take the exam in 2025, you need to start preparing right now and apply for the examination until you get a seat for the exam in the different exam locations and times. You need also a closed study camp for at least 2 to 3 weeks. And this is really very important because most of the candidates are already working and many of them have a very busy schedule with clinics and OTs. So you need at least 2 to 3 weeks before your exam to be fully concentrated on your exam preparation to do the best in the exam. Also, focus on one textbook with additional textbook for the missing things. Do not study from multiple resources. Remember always, studying one textbook few times is much better than reading many books once. And I would recommend, of course, Kansky, which is one of the best books for comprehensive ophthalmology. And it's really one of the best books that have most of the necessary information and most of the necessary things that you need to know before the exam. I would also recommend Ophthalmology Examinations Review by Wong. It's a very important book, and you can memorize the missing things in Kansky from this book. Also, past candidates' experiences and OSCE books. Remember always, common is common. Previous exam experiences is one of the most, and I think it is the most valuable source. You need to study those previous exam experiences and answer the questions by yourself. You'll find a pattern and favorite questions. Stick to that, and almost 80% of the exam will come from it. So you need to print out the previous exam experiences, start with the most recent ones, and try to answer each question by yourself, return to your textbook and study these previous exam experiences. It will help you a lot. And you can, for example, finish one exam experience every day for the last 3 weeks before the exam. So you will be able to get a catch about the most important things that will come in the exam, and you will be well prepared for these things. Also, OSCE books like this book, this great book, Practical Guide to Viva and OSCE in Ophthalmology Examination, again by Tianyin Wong. It's an extremely important book. It has the same format of the FRCS Glasgow Part 3 exam, you will find the most common and the most important cases that can come in the exam. So I would recommend reading this book 2 or 3 times before the exam and studying it very well. And remember, success is the sum of small efforts that repeated day in and day out. So you need to prepare well, prepare early, and you need to continue doing the hard work to succeed. Find a dedicated study partner. Make a group of 3 to 4 study partners, and that is the maximum number. I would not recommend having very large study groups. Preferably have 2 or 3 study partners, and you need to choose wisely your success partners. You should have, and they should have motivation and real willpower to succeed, preferably different subspecialties to help each other in different subjects, and regular focused meetings at least thrice per week. And in those focused meetings, it could be for 1 hour, 3 times weekly. And in these sessions, each one of the study group will prepare 3 to 5 questions with typical answers, and you will ask each other like a simulated exam or mock exam. Give your study partners important comments about how they are answering to help them do better. Before the exam, make the simulated exam session with stopwatch because time management is extremely important in this exam. FRCS Glasgow Part 3 is a very fast exam. You need to answer many questions in a very short time, so you need to practice time management to be able to succeed. Know your exam. I will start with talking about Viva exam. So a Viva exam, we have 3 sessions. Each session has 2 subspecialties, and each session is each session is 20 minutes duration, and in each session you have 2 examiners. First session, neuro-ophthalmology and general medicine. One of the examiners will ask you about neuro-ophthalmology, pediatric ophthalmology, and strabismus. The other examiner is a physician, and he will ask you about general medicine questions or ophthalmology-related diseases like thyroid ophthalmopathy, diabetes mellitus, tuberculosis, and the ocular effects, ocular diseases related to tuberculosis, for example. Also the autoimmune diseases like systemic lupus erythematosus and other autoimmune diseases, and the relation between these diseases and ocular diseases like uveitis. Oculoplasty and anterior segment, you will have 2 examiners. One of them will ask you about anterior segment, cataract and cornea mainly, and the other one will ask you about oculoplasty and ocular oncology cases. The third session, you will have retina and glaucoma. One examiner will ask you about retina and the other will ask you about glaucoma. Coming to the clinical examination, which will be the second day, it comprises of 4 sessions. Each session is 12 minutes duration. First session, anterior segment, and you need to know the slit lamp examination with different illumination techniques in details. Posterior segment, you need to be familiar using the 90D and the 20D lenses. Usually you will get 2 cases, one case using slit lamp and 90D, the other case using indirect ophthalmoscopy and 20D lens. So you need to be familiar and know how to use both slit lamp and indirect ophthalmoscopy very well. The third session, strabismus and neuro-ophthalmology. You need to know cover test by heart, extraocular motility test, confrontation visual field test, and pupillary examination. Oculoplasty session, you can have cases like ptosis cases, proptosis, dystopia, ectropion, entropion, and lid mass evaluation. So you need to know how to evaluate ptosis, how to evaluate proptosis using Hertel exophthalmometer and other oculoplasty diseases. Check this book, Examination Techniques and Cases for Final MRC of MRCS and FRCS by Chua. It's extremely important book. You will find it in Telegram groups and also in FRC Opht Chua website. There are many good tips about how to examine the patients thoroughly and also many clinical cases. The key to succeed in clinical part is to practice many times all the examination techniques in your clinic with your colleagues and keep practicing. Remember, examiners are experienced and they will figure out if you are not familiar with these clinical examination techniques. Plus, time is really short. You need to finish 2 cases in 12 minutes. You need to do the examination by heart and without any hesitance. Hard work, and remember always, hard work is the key to success. Tip number 6. 1 month before the exam, what should I do? Sit with yourself, check where are you in each part of the exam. You need to be above average in each subspecialty. What we tend to do during preparation is focus on subjects that are easy for us and ignore or escape difficult chapters or those that we are not interested in. But remember, this is general ophthalmology exam. You need to answer well in each session to pass. You will not pass if you got merit in neuro-ophthalmology and oculoplasty, but you fail anterior segment or posterior segment sessions. So you need to be above average in each subspecialty. You need to be above average in every clinical session. So remember this always. Tip number 7, request to join Muthusamy Virtual University for Postgraduate Ophthalmology. This is the website. You can check the website and send a request to Prof. Muthusamy. There are many activities for Muthusamy Virtual University, and there is a Telegram group. You'll find a lot of candidates, colleagues that are going through the exam, and together we can succeed. YouTube resources. There are many resources in YouTube that you can use and get a lot of knowledge from them. Check FRCS Part 3 Clinical Examination playlist. Check FRCS Glasgow Exam 3 Experience. And check Dr. Innagar's videos on YouTube, and this is Arabic narrated. Check also Dr. Ghada Zain Al-Abidin channel. You will find a lot of valuable videos about how to prepare for FRCS Glasgow Part 3. And remember, success is only the tip of the iceberg. There are many things you need to do to succeed: hard work, persistence, late nights, rejections, sacrifices, discipline, criticism, doubts, failure, and risks. During the exam, my single best advice to keep calm during the exam. And remember, it is a mind game, as many past candidates said. And I would remember this, one of my colleagues advised me to forget that you are in an exam and take it as a discussion with a senior colleague. If you didn't perform well in one station, keep fighting. You still have the chance to pass if you perform well in other stations. And after the exam, remember there is a grading system to evaluate candidate performance. You don't need to answer every question to pass, and be optimistic and pray. At the end, all the best, and I'm sure you can do it. Thank you.